What is the Nurse Workbook 2.0? If our student nurse content and our new nurse review book had a baby, you'll get this. But if you also expand the content, add more beautiful pages, coloring, everything, activities, here you go. So our workbook is a 300-page workbook. It is much bigger than the Workbook 1.0. It is revamped. It is beautiful. It's incredible. Every single page I'm proud of, and I cannot wait to start this Workbook 2.0 series with you. So what is inside of here? How is it different? So when you open it up, we of course have our RekMED pocket, so you can go ahead and keep anything you want inside. We changed our bookmark this year. We do have a new transparent bookmark with the cutest pattern. It is dry erasable if you would like to use it as that. And when you flip the page over to not just the welcome note, but the very next one, this page is going to go over how you can use this workbook, why it's effective, what kind of techniques we use that really help ingrain the knowledge that you are learning throughout this workbook. So this is a great page that kind of talks about the statistics of how we learn. So jumping into it, we created new sections. We have a brand new assessment section that will go over your nursing assessment. It will show you the content of here's how you are performing the assessment, and then the activity page of what you do. So we also added in the basics. It is a few pages that we've had from some of our old content, and then we expanded more. You will see more pediatrics in this. You'll see more OBGYN in this workbook as well. Tons of cardiac. We expanded cardiac, we expanded respiratory, we expanded neurology, do have more in renal as well. The multi-system is where we actually grew more content inside of it. Gastro 2, there's more things about hepatitis, sedation, let's see, OBGYN, as I said. And yeah, so getting into it further, we also have the review questions as well. So the nurse review content questions that we ask in this book are also inside of here. So you're not only getting the activity pages, but the review questions as well. So let's check out some examples. Every beginning of the workbook, you will see this whole checklist. So you're welcome to kind of use this how you want. Maybe things that you need to learn, maybe things you feel successful in. Maybe you just want to write down whatever the heck it is for your class assignments. You can also check off the sections as you go along, not just here, but also in the table of contents as well. So page 1, you will always find that on the left side of the workbook will be where you're going to learn. On the right side is going to be your activity page. So for example, here's your anatomy, just to get you started. Here is the activity. One thing about the workbook is if you're not feeling as confident, you can keep it on your desk just like this, so you really can have your answers right beside each other. If you decide, or maybe use a pencil, you want to erase and then you want to challenge yourself, you could utilize that spiral, you could fold it over, and you could do it without any kind of reference sitting here beside you as well. Moving on to the next page of our assessment. We talk about the nursing assessment in general, what that looks like, the general survey, and all your physical assessments. Of course, there's activities to follow. So your assessment page, again, if you're going to be assessing things like the throat and the neck, we have your basic anatomy here, and then how are you going to inspect, palpate, assess all that stuff, and it all guides you over here on this side. I'll show you one of my other favorites. We have our respiratory and cardiac. So we all know where we need to listen to those sounds, where we're going to auscultate at. Here's some anatomy. And then over here, it's up to you to kind of draw in what you're doing, and as well as cardiac. We have our sounds we want to listen to on the heart, but what are those sounds telling us, and why do we put our stethoscope at a certain spot? And here it's going to quiz you as well. So pretty standard. We'll move on to our basics section, and this also, again, has your review questions at the end of each section as well. So you can test yourself. Once you've gone through the entire section, then I recommend that you do this part right here. More free write pages, as you can see. So going to the basics, we have our infamous organ page, really talks about all of it. And here you're going to do a fill in the blank. So this will really get your brain kind of thinking. We're prompting you, but you also need to think about what would be the best answer to fill in. These might be tactics that we've done when we were in younger years of school, but there's a reason we do it, because they actually work. I will say a funny story about this page is I can remember being in nursing school. I'd actually had a surgery, and in the middle of class, they were teaching about the pathology of something. And I remember sitting there thinking, I don't even know what the pancreas even does, or I don't even know what the spleen does. When you're in those early steps, you don't really know what every organ's role is. So this is a very good example of how we start So basic, why you don't have to be a nurse to use this workbook. You could be interested in medicine. And then we're gonna go all the way up into mechanical ventilation, into what the alveoli is. This page is actually about pediatrics. This talks a lot about the PAT triangle you're gonna see in the hospital. Also surfactant, what that is and why it's important. And it definitely goes up into advanced concepts. We also have our cardiac section as well. So again, we're starting from the anatomy, and then we're going to build into circulation. It's really hard to do. And what does circulation mean? This is actually a very important concept to understand anything with hemodynamics in general. And then the layers of the heart that also correlate with all the illnesses that we can get because of the anatomy, going into what is the EKG? What does every single little wave on an EKG paper mean? This is one page that a lot of you might have seen in some of like our ads or the videos and demonstrations that we do. This is blank for a reason because we want you to rewrite stuff. We want you to rewrite it. So not only do you have to read it, but then you have to put it over here, and that is going to get inside your head. We've built this truly to help you learn and get this information to really be stuck inside of there. We'll move on to our respiratory. Actually, also in this workbook and in our nurse review, we even have things such as what is a balloon pump? What is ECMO? Now, most of us in nursing aren't ever going to be around a balloon pump or aren't going to be in ECMO unless we're in the ICU, the CICU, or something more critical. But that doesn't mean that we can't just know the nitty gritty of what it is about these concepts. I can remember people talking about how the patient needed to go on ECMO, and I truly didn't understand. Does that mean they're actually on bypass? Does that mean what? What is ECMO? How do we even do ECMO? Here's just the basics. You have little things that you're going to want to look out for. Like there is an ECMO technician. They do daily x-rays to make sure nothing moved. There's a whole bunch of things to it, but I think it's something that's just truly important because the more knowledge we have, the safer we can be for our patients. And this is going to be your activity as well. Very define what it is, what are these objects, and also relabel everything as well. Moving into the respiratory section. Again, we start. Look at our anatomy, fill out our anatomy. And what is ventilation? So we always hear about how we breathe, that we want to know their SpO2. Are they perfusing? Well, ventilation is actually a massive part of breathing. And it's a word that we don't always frequently use. And this is something that's going to be a very important concept when we're actually doing patient care. So there's a couple ways that we ventilate people and the goals that we strive. So again, we're going to start with what are the basics. And then here's our activity to help define everything. Move from what is a nasal cannula and what is a non-rebreather to what is intubation. And then we're going to push through and we're going to get you into mechanical ventilation. What is the VQ match? And this actually, again, is saying that we need our ventilation, our perfusion, our diffusion. That equals us actually moving air in the gas exchange. So very basic stuff that works into more difficult stuff. That is why you do not need to be a nurse to understand our content. And then we'll move into neurology. We're talking more about sedation here, our review section with the free write page. Neurology, again, you have your check boxes. You can do what you want. We have our anatomy, and then it goes into what is the nervous system. It's such an important part when it comes to doing a neuro exam, even with our spinal cord. So we're starting with the basics and we're going into the more extreme. I've said it over and over and over again. So many activities. I will be doing a workbook series with you guys. We really expanded into a whole bunch of topics. Everything just got bigger and better this year. Of course, our workbook is going to have the infamous lab page that a lot of you really like, but one of my most favorite things about this is that we have our index. So if you are in class or you are on shift or you are somewhere and you hear a word and you are just not sure, we put it back here so you're able to find exactly what page it is. Like if you heard the word diffusion, you can look it up in our index, and you can also check it off and just go through your index if you really wanted to kind of test your knowledge. We also have, of course, our sticker pages. And these are some of my most favorite stickers to date. There are 2 pages of stickers back here to really help you kind of mark the things that you want that are important. We also have, all the stickers have their subsections too, so you can utilize them to the appropriate subsections, and they of course are color coordinated. So that is a glimpse into our new nurse review book. This is our best-selling book by far. Every single page when it was created was, is this going to be something that's really going to help you retain your knowledge and your information? So thank you so much for sticking around, looking at this review about the Nurse Workbook 2.0. This probably is the book that I'm the most proud of. We do have places that are integrating this into their new grad programs. So I feel super blessed and fortunate that it's becoming a book that is really going all over the country these days. So you guys, thank you. If you have any questions, if you have any feedback, we're always looking for a way to improve. We are a company that we take your feedback very seriously. Please remember, everyone, that you are talking to humans when you talk to anybody at RekMED. So we'll take it all very seriously and bring it to the team. Have a great day, and thanks so much, guys. We'll see you on the next.